I am your host, Kumal Joshi, Head of Strategic Finance at Jounce Therapeutics and BD and Finance Co-Chair for MassBio. To everyone that has joined us, I want to welcome you to this morning's panel session titled Raising the Bar on Leadership for the Evolving CFO and Financial Executive. The idea for today's event stems from the continued attention that leading business schools have given on the ever-evolving, multidimensional role of the financial officer. And today, we have tailored our discussion to be more applicable for the life sciences sector. This session will be moderated by David Lubner. But before I hand it off to David to introduce himself and the panelists, I want to spend a few minutes to set the stage for our discussion. As many of us may have experienced within the life science ecosystem, the role of the CFO and financial executive continues to shift. From assuming increasingly complex responsibilities, such as managing day-to-day operations, to driving value across the business, all while navigating the markets and volatility. We also plan to address leadership during COVID-19, and most importantly, diversity and inclusion ideas and initiatives. We have 1 hour allotted to this panel, including questions that were prepared in advance. We will have time for live Q&A for the panelists. So if you have questions, please go ahead, submit through the Q&A icon at the bottom center of your Zoom screen. David will address the most frequently asked questions or the ones that have the broadest significance to the audience. This session will be recorded. Thank you to MassBio for hosting this event. And with that, David, please go ahead.
Good morning, and thank you, Kamal, and a warm welcome to our panelists. Terry Ann Burrell from Beam Therapeutics, Pauline McGowan as Senior VP of Finance at Signal Therapeutics, and Hunter Smith, Interim CEO and Chief Financial Officer at Rhythm. And finally, Senthil Sundaram, who's the former CFO at Nightstar Therapeutics and is currently a board member and audit committee chair at Axovant Gene Therapies. We plan to cover a variety of topics as Kamal outlined, and I think you'll find this morning's discussion from these panelists and perspectives from these panelists quite inspiring and enjoyable. So I think as we sort of kick this off, I wanted to just sort of outline a couple of topics that we're going to be touching on, some of which Kamal's already introduced, but essentially we want to cover what emerging finance leaders should think about as they step into the CFO and financial executive role. And then for those that are taking on their second or third role, what they should keep in mind to ensure that they're able to consistently lead with success. And then importantly, as we all realize and know, we count on a team. So we're going to talk about team building and who we need to recruit and the different phenotypes we need to recruit to be able to support the finance function and to succeed the CFO. And then importantly, cover topics that include career progression. I think you have a variety of panelists today that'll give you a different perspective as CFO or senior financial leader in private venture-backed companies versus public companies, important board dynamic issues, and then the topics that are front and center, COVID-19, diversity and inclusion. So we've got a lot of wood to chop this morning. And with that, we're going to sort of turn to our panelists. So I'm going to lead off with Hunter. And Hunter has a really unique path to the role of CFO and importantly, his recent appointment as interim CEO at Rhythm. So with that, I'm going to turn it over to Hunter.
Thanks, David. I'm Hunter Smith, interim CEO and CFO of Rhythm, as he said, and made some reference to a unique past. And I'll just say maybe professionally unique in that I was a history major. I fulfilled my college science requirement with astronomy. I was always most interested in commodities and natural resources and international relations. And I spent about 15 to 20 years of my career in that world. I was with a large multinational company for about 15 years where I worked on 4 continents. And it was a high growth period. So I had the opportunity to serve in different functions in a multinational, which doesn't happen as frequently even in large pharma because the roles are very verticalized and the companies are very verticalized. And that gave me the opportunity to do investor relations, to be treasurer, to work in risk, to work in business finance. And at a certain point, the financial crisis, i.e. the last one, came along. And just as that was happening, we got a new boss. And the new boss was a tough-talking Texan by the name of Jackie Faust. And some of you may know Jackie Faust. She's now the CEO of Agios. That's how she says it. But anyway, so Jackie and I went through the financial crisis together. And she promptly got through the financial crisis and said, I had enough of this. And Celgene called her and asked her to be CFO, and she left. And that was a very depressing event for me. But a couple of years later, she called and said, you know, we have a new business. It's this inflammation immunology business, and we have this compound, which eventually became Otezla, which we're going to build a business around, and I need a finance leader for that business. And so I said, you remember that I fulfilled my college science requirement with astronomy? And she said, I know, but you've got a lot of good finance skills, so why don't you come over here and give it a try? So that's how it happened. I clearly was the benefit of relationships and networking and things like that. But what I would say is people who've grown up in this industry don't leave it for a very good reason. It's a very profitable industry. It's a very dynamic industry. And people, and it's also very fragmented, which means there's lots and lots of job opportunities. Agribusiness, where I used to work, had 4 major companies in the United States. And when I looked at the adjacent opportunities to become a CFO, the best one I could look forward to was, you know, going to like Tyson Chicken in Springdale, Arkansas, which is a very good company, by the way, and fulfills a very important purpose. But you could see why I might prefer biotech in Boston to doing something like that. So I would just sum up to say I've had a circuitous route to get here. It was interesting, it was fun, but I'm really thrilled to be part of biotechnology and thrilled to be part of Rhythm Pharmaceuticals.
Terrific. Thank you for that colorful introduction, and it's good to hear. And so with that, I'm gonna, introduce Terry Ann, and Terry Ann has a sort of an adjacent, non-traditional route to CFO-dom. Terry?
Good morning. I'm kind of hurt that I've got to follow Hunter here.
Well, maybe you can put on some accent and.
I know I'm not very good at that, even with my Jamaican self. My Jamaican accent's not very good. A lot of what Hunter said actually resonated with me. Good morning, everyone. My name is Terry Ann Burrell. I'm CFO at Beam Therapeutics, where I joined about a year ago from JP Morgan, where I was managing director in the healthcare investment banking group, covering pharma and biotech. And like Hunter, I fulfilled my college requirement doing one anatomy and physiology class. And I studied social, political, and economic theory and never dreamed about being a banker, let alone being a CFO. So I do pinch myself every day that I'm fortunate enough to actually have this opportunity. I think, as a banker, which I ended up in that spot because I'd spent 6 to 7 years almost in equity research, and you learn a lot in equity research from strategic perspective, how to think strategically about businesses, and importantly, how those strategic decisions impact investor engagement. And, from a banking world perspective that had often been pretty insular and thinking about how do I do what a client wants me to do as opposed to necessarily giving active advice. I was coming into banking just at that time where things were really changing and folks were really trying to get ahead of clients, ahead of the relationships with clients by providing active advice, right? Active strategic advice rather than pure execution. And that skill set that I developed in research was particularly attractive. And went to JP Morgan, had a fantastic experience, ended up in biotech because at the financial crisis, it was pretty clear that lots of people were going to get laid off. And where in the world could you sort of find a seat where business was actually going to be growing? And biotech was that space within healthcare, that segment was going to take off. And I thought, I know nothing about science. This is all hieroglyphics to me. And I'm going to put my head down and learn as much as I could. And it was the right decision. Learned a ton and really saw a lot of companies grow up and do IPOs. The first IPO I did was Telecrest, if anybody remembers that company, exactly. And then it was the last one for a long time. But banking did provide a broad set of skill sets, both on the M&A side and the equity side, where you continue to see and develop that strategic thinking and understanding the market dynamics from a capital markets perspective, what resonates with investors, what doesn't, what did companies do well, what could they have done better, and really putting all of those things together. And, you know, it sort of felt as folks started reaching out to me about CFO roles, I was thinking, yeah, no, I'm not that right person, right? I'm not an accountant. I don't have any operations experience. What kind of value can I really bring to a biotech company? And, you know, over the years, it became clear that, as Kamal mentioned, that role was evolving and really needed lots of different ideas and people at the table to really make it effective, given how capital intensive the business is. So I'm going to stop there, and we can cover additional. Let others go ahead, and we can talk more.
Absolutely. Well, thank you very much, Terry, for that. And with that, I'm going to turn to Pauline, who can give us the perspective of a private company CFO. And as part of that, Pauline, if you wouldn't mind, just including, your perspective and ideas around how CFOs and senior financial leaders should be spending their time, and really, just the balancing act of the pure play financial reporting elements and the accounting operational elements to some of the more strategic issues around preparing the company for business development and partnering initiatives. So with that, Pauline.
Sure, great. Thanks, David. So Pauline McGowan, I'm the SVP of Finance at Signal Therapeutics. We're privately held, and we were founded in 2007 from the flagship Venture Labs. Just to give you a little bit of background on the company, because it does give context, Signal was the first company to build a platform to investigate signaling between peripheral neurons and disease tissue. This whole concept is outside of traditional neurobiology, so we even had to come up with a term to describe it, which we created, which was exoneurobiology. So Signal is a very early stage company. We're preclinical. It's a platform company looking at a very novel biology. And that really dictates how I spend my time. I did come up through just to have more of a traditional accounting and operations background, which has really I kind of feel that the private company setting is my sweet spot. It's where my skill set really can play a great role, and it's what I like to do, more importantly. I really like to be able to have my hands in a little bit of everything. And, my days are, sometimes it's human resources, sometimes it's looking at legal agreements, sometimes it's dealing with lab operations, building out a website, but I like that diversity of just working in a lot of different areas. So where I devote most of my time is obviously we're private. We have to be very careful about our capital spend and where we're investing our resources. So since we are a platform company, we can point this science in any direction. So really working with the scientists and start to build out some, good tools to be able to portray where we're investing our money, and how much are we investing in the platform versus our drug discovery programs, and making sure that we can hit our next timelines. So really trying to lay some really good business practices early so that we have, Gantt charts, monthly reporting, and really just keeping the infrastructure in pace with the science. So definitely don't want to let the G&A spend get ahead of the science. So we're trying to plow as much money as we can into R&D. So like right now, I think we're 85% of our spend's R&D. So only as much as we can, we're, really pushing to the science, because that's what's going to drive the value. Yeah, that's pretty much my background.
Well, we certainly hear you about doing R&D in a fishbowl and then having to report quarterly on how that is. But thank you for that, Pauline. With that, I'm going to turn it over to Senthil Sundaram. Senthil?
Thanks, David. So I think like a lot of folks here, I probably have to talk about my lack of life sciences background. I think the last time I took a biology class, I was in high school. And even though I took organic chemistry during my undergrad, I was so bad that I actually almost thought about walking out of my final exam. I was at Brown. If you don't finish your final exam, they don't give you a grade. So you don't fail. You just don't get a grade. Luckily, I managed to pass, and I got a decent grade, so it all worked out. But I think the path to biotech was one that was very fortuitous and unexpected. I spent 13 years in investment banking, primarily focused on the life sciences sector. And I had the opportunity to really work across a few different banks and across a lot of different focus areas. So worked with big pharma, worked with biotech, worked with spec pharma and other areas outside of life sciences as well, including services. And had the opportunity to work across a lot of different transaction types as well, M&A, licensing, equity deals, fixed income. But I think the key takeaway for me is that I learned a lot about client service, and this helped me when I made the jump into industry, because I thought a lot of my colleagues as really clients that I had to service, and also when I was dealing with investors, really focused on having a high touch relationship. I think that really helped me make that transition effectively. So after 13 years in investment banking, I ended up making the move into industry, first to Intercept Pharmaceuticals, where it was a very ambiguous title, the head of corporate development. I think at some point it changed to the head of business development. But really my role was pretty broad. The company was just 20 people. The company had just gone public right before I joined. So I had the opportunity really to have responsibilities spanning, I think, quite a breadth of functional areas, everything from financial planning, but also commercial strategy, financial reporting, investor relations, even competitive intelligence, and ultimately business development. I think that set me up really well for my CFO role at Nightstar, which I started about 3 years ago, where I had a lot of responsibilities like you might expect, like finance, investor relations, but also I really led a lot of the business development efforts, including the process that ultimately led to the sale to Biogen, and also worked really closely with our CMO, our CSO, and our head of manufacturing on really trying to think how a lot of those different strategic elements worked into our overall financial planning, our business development planning, and strategic planning. Now, currently, I'm a board member, and as David mentioned, audit chair of Axovan Gene Therapies. And I'm hopeful, I'm crossing my fingers, that I'll be announcing a new CEO role pretty soon.
Terrific. Nice, nice to hear. And Senthil, just while we're chatting to you and you're giving your background, can you give us a little bit of a perspective of your experience with interaction with the boards, and really, since you now are as well a board member and sort of audit committee chair, and view the finance function and the CFO from the board perspective, it'd be really interesting to get your perspective on both sides of the table and how a CFO and their finance team can prepare to be most effective during that usually 4-hour marathon session where everyone crams the night before?
Yeah, I think for me, the biggest lesson, and this was, I see it from one side of the table as part of the management team at Intercept and Nightstar, and then now on the other side of the table at Axevant. I think the biggest learning for me was that the board meeting is really just sort of the last mile of the marathon. And really, there's a lot of prep work that goes into the board meeting, both in terms of preparing materials and coordinating with everyone on the management, inside the company, but also really spending a lot of time with individual board members, such that really the board meeting is an opportunity for all of the board members to sort of talk about the material that you previewed with them, as opposed for it to be the first time that you're presenting the material to them. So I think for me, board meetings became a lot smoother once I realized that I need to have a lot, more frequent discussions with board members and really spend a lot of time previewing and refining materials ahead of the board meeting. And certainly the situation you don't want to be in is where you're presenting material to a board member for the first time at that board meeting. And in worst cases, if you're surprising them with new information at that board meeting.
I heard you had a fantastic audit committee chair on that Nightstar board.
Absolutely, absolutely.
Yeah.
It was great. He offered up a lot of time, and I think the other benefit that I had in moving to Boston, and something that I offer up to folks who are thinking about a CFO role or are newly taking on a CFO role, is really to leverage the network here. I think most of the folks, certainly on this panel, I've had the opportunity to connect with either before my time at Nightstar or during, and I think a lot of folks are happy to pay that forward.
Terrific. I see we're starting to get a few questions on the Q&A board. And so I'll hold them until we get a little theme going, but happy to add their questions. I think now I'll turn to Pauline, who in preparation for our talk today gave a really interesting perspective on preparation and really dealing with COVID-19. And so with that, Pauline, could you share your experience there and give some pointers to the rest of the panel and the audience on how you guys are dealing with COVID-19?
Sure. So yes, so we definitely, with COVID-19, where we are I had described novel biology, when we look at what our resources needed to accomplish our 2020 goals, about greater than 70% were dictated by internal resources. So COVID-19 really hit us hard. I mean, we closed down our majority of our labs for about a month, but we couldn't continue that way. That was going to be have a very large impact if we couldn't get our labs up and running. So I think we've done this, we're in phase 2 now, our own Signal phase 2, where we are pretty close to, I would say, almost 100% back in the lab. But it's, taken us, this long to get there. I think every company is different. I think one of the things that you have to definitely look at, what we looked at, was what's your biggest constraint? For us, it happened to be our tissue culture rooms, so that our scientists needed access, a lot of access to those rooms, and they're very confined spaces. So it was we were not going to be able to operate the way we had in the past. So that really dictated how we came up with our plans. Our demographics, like the whole school and daycare closing, did not really impact us. We have a young workforce, but I could see with another company that could be a constraint. So I think that really approaching it that way, like what is your largest constraint, and trying to solve for that. And then also really making sure that you involve and listen to your scientists. We did a survey to really understand, what people were experiencing, what was going to work for them. We laid out 4 different proposals on, how we could, go to the next phase from phase 1 to phase 2. and, you know, really understand. Surprisingly, like day-night shift was not popular. It was very unpopular. So I think that's important to, you know, really listen to your scientists. Another thing that we learned from that survey was just that with the transition to remote work, we had just a complete multiplication of meetings and really a meeting Zoom call burnout by our scientists. And as they were trying to get back into the lab, that just even made it worse, because now they're trying to, like, you know, they're in the lab and then they're having to take Zoom calls. So we kind of came up with best practices and have certain preferred times, which is really like the bookends. So basically the beginning of the day and the end of the day, where meetings should be scheduled that involve scientists. So that's pretty much what we've been doing, and also looking at the mix of our real estate, and you know, potentially taking on a little bit more space just to give us that extra flexibility. Our existing lab space was 60-40, so we have 60% office and 40% lab. And we definitely realized that going forward, we would really, I'd rather prefer 75 lab, 25 office, because, you know, the non-lab work transitioned very smoothly to remote work.
Got it. Thank you very much. I'm going to open it up to the other panelists, Terry and Hunter, on leadership during COVID-19 and certainly Central as well.
Yeah, happy to start. I think, as Pauline said, listening to your employees and understanding where they are and what constraints they have, what concerns they have, is probably one of the single most important things that we did during the process, and I think ultimately paid dividends. You know, it is important to recognize that everybody has a different set of challenges. You know, unlike Pauline, we did have lots of folks who had children. And so for them, they had to deal with no schools, no babysitters. How do you help them manage through that process? And ultimately creating the flexibility that allowed everyone to continue the work that they love, but also making sure that we were protecting them appropriately and making sure that people understood that safety and their safety and the safety of our community was the priority in the process. So we started off, and we were very fortunate being a preclinical company, I would say. I think not having to depend on external sources who you cannot control was very helpful in the process. So we did start off initially really restricting access to the facilities only to folks who needed to be there to do things on site. So for the most critical functions, and then only in limiting the number of people who could be on site at any one time, and everybody else worked from home. We obviously, as Massachusetts has lifted some of the restrictions and moved through the phases, we've obviously shifted as well and moved to having more people on site, but still being very cautious, having shifts in place, limiting the number of people who are in the labs at any one time, having full PPE available, making sure the protocols are understood. And I think we've made a very seamless transition as more people have gone back into the office and continue to keep those lines of communication open. We had lots of people throughout, we want to go back to the office, we want to go back to the office, we want to go back to the office. Because again, so much of people do this work because they're passionate about what they're doing, and they're passionate about the difference that we can all make with the work that we're doing, and being at home and not necessarily doing the experiments that you want to do, you know, felt pretty stifling. So, you know, I think folks are pretty excited to get back into something that is more normal, not quite normal, and unclear when we're ever going to actually really get there. But it's something that's a little bit more consistent with what they're used to.
Thank you. Hunter? Central?
Thanks, Terry. And I would say, by contrast, we actually don't have any bench science going on inside our company. So the experiments are done externally, or are externalized. And so everybody is essentially an office worker unless they're a field person. And there are a number of challenges that come with that. One of the advantages, of course, is we don't need to lead anything in terms of getting back into the office. Although we did go through an in-person FDA inspection as our first in-office exercise, because we submitted our NDA in March. It was accepted, and they did their inspection, their GCP inspection on site, and we had to prepare for that quite quickly. So that was a pretty intense period. I had very little direct involvement in it, but you can imagine for the reg team, the quality team, and the clinical team, procedures had to come up the curve very, very fast. The other thing I would stress is communication is very complex, and organizational dynamics are very complex. And one of the things that troubles me, and I think troubles our team, is that while vertical communication may work very well, I speak to my direct reports all the time. They speak to me proactively all the time. The sort of matrixed communications that happen in an office setting just go to zero. So I try to talk to a lot of people around the organization without structure, just set up a meeting, talk to them about, I would say I would talk to them about baseball, but there is no baseball, but you get the point. I try to talk to them about how they're doing and what's working, what's not working. And some people take it straight to the company, and some people we chat with about, what are you binging or something like that. So binge watching. The point being that facilitating cross-functional impromptu conversation is extremely hard, and trying to do things that allow that to happen. As a CFO or as a finance leader, that enables you to be closer to what's going on in the business and be better at your role. And it also facilitates improved organizational dynamics while we're all working remotely.
Gotcha.
Maybe to add two more perspectives to that, I think there's certainly a lot of internal operational focus in terms of how do we enhance things for our teams internally. I think the two external perspectives, I think, would be one from perhaps an IR or financing perspective. I think when maybe 3 months ago, I think we're all worried that this was going to shut down the biotech financing markets, and that we really need to think about how do we extend our cash runways for another quarter, 2 quarters, or a year. I think you've all seen that that's certainly not the case, and I think that's a great thing. Both the private markets are open, the public markets are open, and if anything, I think COVID has shown a spotlight on the need for continued investment in different areas in biotech. So I think that's a great thing. Maybe a tougher part for a lot of companies to deal with, especially those clinical stage companies that are in the midst of running trials, is how do we weigh the balance of what's best for the company in terms of trying to meet our timelines and what we say to investors, and trying to hit these milestones before we run out of money, and what's best for investigators and the folks that are at the clinical trial sites. And it's a tough balance, right? There may be some programs where you can afford to wait 3-6 months and the patients will still be fine if they're treated thereafter. But there are others where you really need to treat them right away, right? And I think we need to work together. And I think Hunter's point about cross-functional communication there is really helpful, right? If your ClinOps team needs to spend an extra X amount of money so that they can fly patients over ahead of time, or maybe send CROs out to do remote visits and things like that, I think that's all becomes more important here. I've seen a few companies do some really innovative things on that side. And I think the challenge is going to be COVID and how we think about clinical trials is probably not going to change for the next year or so, right? I think maybe even longer than that. So I think it's going to be potentially a longer term issue for us to manage over the next 12, 24 months.
Gotcha. All right, terrific. And so a question that had come from one of our audience members, staying on the IR theme, and importantly, Senthil, you've touched on some of it in the context of IR outreach and company presence in a virtual world that's impacted by COVID. And so the, typical in-person one-on-one meetings and company presentations that occur at all the healthcare investment banking conferences, scientific and medical conferences have now had to adapt to a virtual world. And so just in the IR theme, in the capital markets theme, this question comes from an audience member around trying to understand what the most value an IR professional can provide to a CFO, A, in a pre-IPO setting, and then B, as part of the IPO and post-IPO. So let's see, I think, Terry, you're the most recent to go public. Give that perspective. And then Pauline, would love your perspective on, I know you're super early given your preclinical stage, but just a pre-IPO setting perspective as well. But Terry?
Yeah, no, thank you for that. I will say that the IR professional has a lot of access to many different companies and many different investors. And getting from them sort of the unspoken, right? What's that underlying sense of what's happening in the market? What are investors really concerned about? Not necessarily about the Beam story, right, or the Rhythm story, but generally, where are they thinking? What are they looking for? What's their exposure, broadly speaking? And what's going to move the needle for them? And then on your specific story, what are they saying to you that they aren't saying to management? Because you always have to, I've come to appreciate that there is a lot that investors won't necessarily say to management because they want to protect their allocation, whether it's in the IPO or a follow-on 2 or 3 years down the road. They're very focused on, I don't want to offend anybody ever. And so they may not always give you the full story, but that full story is likely to come out in a one-on-one conversation with an IR professional, sometimes in a one-on-one conversation about another company entirely that IR professional may cover. So you want to create that dynamic with your team, that it's an open conversation, right? No offense taken. I just need to know the good, bad, the ugly, because otherwise we can't appropriately address anything. I also think recognizing what kind of check sizes people are prepared to write, right? Are they really long-term investors, or are they really just saying that, right? And that also helps you as you think about what kind of shareholder base do I want to build, right? Do I just want to get capital and I don't actually care? Or do I want that combination of long-only mutual funds or really smart healthcare investors? And that IR professional is going to be able to tell you, where do people really shake out? When that allocation happens, what are they actually doing with it when it starts trading? You're going to get those insights, and that's going to be important. The IR professional, and so that's important in a pre-IPO setting, and that's also very important in a post-IPO setting. Post-IPO, I think coming up with what that right strategy about remaining engaged with investors is critically important, right? You can continue to flood the market, or how do you think about waiting, staging that engagement, making sure that you're not, you haven't disappeared completely, but you're staying in front of them at just the right level, because I do think that there is that saturation point you can get to where people feel like they've seen you enough, heard you too much, and so when you have some really exciting information, they may not be plugged in. How do you prep the markets for what's coming without really leading them, right? So really training them to know what's coming, and ultimately just managing. This is all about, as I've come to appreciate a little bit, managing expectations. You can't let expectations get ahead of where you are. You always want to be in a position to be exceeding expectations. And that active engagement with investors, both on the IR side and the company side, will allow you to understand where expectations are at the moment, how you need to pull them back, or whether you need to size them up or down. And the last thing I'll say is, the analyst, the equity research analyst engagement is also critically important. And you do that directly as well, but the IR professional does help you and does have line of sight into which analysts do investors really read, which ones do they actually really care about. And that helps you in terms of how you think about what the right syndicate is going to be, because some of the syndicate is very much about having the right banks and the right distribution, but there's another part of that syndicate which is just about research distribution, right? And some of those names may not be obvious, where folks are really digging in and paying attention. And so understanding those dynamics is also very important.
Perfect. Thank you. I wonder if any of you have had a virtual non-deal roadshow yet, but that would be interesting. Have you, Tara and Hunter?
Yeah,
Great.
yes.
Yeah.
Yeah.
Tell us
Hunter go
about that. Yeah.
Well, it was interesting. We had heard the observation that that this was actually a good way to go to Europe without paying for it. So,
and you're not allowed but other than that, sure.
Right, exactly. Well, and so we asked one of our banking partners, and I checked with a couple of, again, to go back to Senthil's point about really leveraging the network. I asked a couple of my colleagues at other companies, who would you use? And I got some feedback. And so I selected a banking partner to say, would you take us and make some European introductions? And they did. And it ended up really being 2 mornings, starting early, but we had 2 full mornings of European calls with people that were getting to know the story for the first time. So it was successful and it was worth doing. And I would say the conferences are, seeming to go relatively fine as well. You don't have in the hallway bump-ins to people and the impromptu chatter, but you have plenty of direct investor engagement.
Terrific.
I agree with that. I think it's incredibly efficient. And you also don't feel bad about flying to St. Louis and only doing 2 meetings, right? You still have your day to engage with all the things that you need to do to keep the company going, but you can very quickly hit 3 or 4 meetings in the middle of a day or in the morning or late in the day to satisfy that demand. I think it's also helped with follow-up. We actually did a non-deal roadshow just yesterday. And this particular investor had tons of questions and said it was clear we weren't going to get through everything. And within 30 minutes, another day has been scheduled to kind of complete that follow-up. So you're very quick in sort of just closing the loop.
Yeah, I mean, I think even in a pre-COVID world, European investors were sort of not overlooked, but I know there were a lot of bulge bracket firms that say, on your testing the waters roadshows or other roadshows, don't waste time. My experience has been quite the opposite, that they appreciate touch points with US-based companies, and Senthil certainly has a unique experience, given that Nightstar was a spin out of the Glaxo Wellcome Trust and was based in the UK too. But I'll be interested to see the Jefferies London conference in November, how that turns out, but I'm sure they'll put on a great show.
I'm still hoping it's going to be in person, but I'm like, there are worse places to be in November.
I know, exactly. All right, terrific. With that, I just sort of checking time here. We've got about 10 to 15 minutes left, and wanted to shift some of the discussion to some of the inward-facing company building culture topics, including, and importantly, the topic that is front and center today around diversity and inclusion, and just importantly, given your roles and positions as leaders of the company, to talk about what actions you plan to take and put in place, or already put in place within your teams and at your companies. So I'll open that up to the panel.
So I'm happy to start. I think one of the things that I have 2 two adjacent thoughts. One of them is, having come from an industry that was significantly less diverse than this one, and also much more oligopolist or much more concentrated, and much, much less profitable. I would say that this industry is great in the sense that it's very dynamic, it's very fragmented, it's talent deficit as an industry. It still is, even during COVID. And so part of our job is to help address this problem as an industry and be leaders on this challenge as an industry, rather than letting the Massachusetts legislature or the federal government or others try to solve it for us with top-down measures. That will constrain us as an industry and will restrain the dynamism. And that dynamism presents great opportunities to people from all kinds of backgrounds. And the second thing is that the small cap companies, the small biotech companies, face a challenge of scale in terms of putting programs together to help people from disadvantaged backgrounds to potentially access opportunities in the industry, whereas a large cap pharma company can do targeted recruiting, group development and training programs and things of that nature. So if you have not seen it, MassBio put out a terrific press release and access to resources about, I think, the 20th of June. And it is a perfect example of what I think MassBio can really do, which is solve that problem of scale across the industry, provide access to lots of opportunities for small companies to access directly in ways that they won't be able to develop internally simply due to scale constraints. So I really applaud MassBio, and I think MassBio is going to have opportunities to take all kinds of leadership positions in other people issues that challenge this industry over the long haul. So check that out, and I think it shows potential for great progress.
Terrific.
Yeah, I mean,
go ahead, Pauline.
Sorry, no. That's great. I think that it's great for I definitely think that there has to be like an industry-wide approach to it. I know with Signal, I'm like intimately involved with all of the hiring, and it's so hard to hire people, and that whenever we like closed a candidate and actually convinced them to come to an early stage company, I was just so excited. So I think we definitely have an inclusive environment at Signal, but there's always like work to be done, and it definitely needs to be addressed. I think at my prior company, Ginkgo, one thing that they had done, which I think we're looking to do at Signal, is a diversity inclusion council, which is really more of a grassroots. So it's definitely supported from management, so top-down support, but then bottoms up, which I think is really important, because I think that everyone has their biases, and that to really, just lay it all out there. I think that's a really a great idea, and just really be very transparent and see what all your employees think as far as how really diverse and inclusive you are.
Yeah. And I think that's a great segue for Beam. Certainly, we actually do have an inclusion and diversity team at Beam, and as issues of social justice really started to emerge, it started to coalesce first with that team, but broadly with the company as a whole. And I think some of that is driven by the fact that we lead with our values. Everything starts and stops at Beam around the values. And that's how we really engaged and started with this conversation. And I think this is my first operational role, but I've seen a lot of biotech companies, and I will say that I'm proud that I think Beam is already extremely diverse. And the one thing that we said, though, is it's great that we're diverse, but we're not going to just stop there. It's always important for us to keep pushing and making sure that we're not getting very comfortable, because our employees consider us to be diverse. We consider ourselves to be diverse and we're all aligned there, but it's not enough. We've got to keep doing more. And how do we keep doing more? And how do we create space for people to really feel comfortable engaging around all of these issues? And I think we've certainly started to do that as we've thought about, well, what do we actually do next in this environment? And it's not just, yes, we've got to go find people, because we all hear the stories that, you know, we'd love to hire Black men and women, or we'd love to hire other diverse talent, but we just can't find them. And taking that industry approach around, how do we start to create conversations with universities and organizations, that engineering organizations, whatever it is, that will have access to talent, and have that convincing people that they do want to come work at an early stage biotech company with all of the risks that's involved, right? So that at the sort of top, you know, industry level is something that we're certainly going to need, but also recognizing we're healthcare and there are very unique issues, as we've seen with COVID-19, which is disproportionately impacting, you know, poor communities, Black and Latino communities. What role and voice do we have in that? And where does that responsibility lie? And broadly with healthcare, right? People talk about the disproportionate impact all the time. You know, so where can we actually make changes, right? Which lane can we operate in and really have a broad impact? And in areas like healthcare, you know, that's a place where we think we can have an impact because we know the space. And I think that's where our team has really started to coalesce around as well.
Thank you. Thank you for that. I see a couple of quick, there are a few questions, Komal, so before we wrap up, I'd like to try and just certainly respond to a couple of the questions. The first of it comes from someone who is coming to the life science industry from software tech, and any advice for a finance professional making that transition. Senthil, do you want to take that? You certainly have the tech background and computer science background as well. So.
Yeah, so I think for me, in really all of the companies that I've been involved with, I've tried to be the novice who reads a lot and is not afraid to ask silly questions. So I think these days there are a ton of resources. I remember, you know, maybe like 10 or 15 years ago, you know, going to the MIT website and going through all of the video lectures on biotechnology. And I think some of those are still available and probably even more advanced today. But everything from that to diving into PubMed and doing a lot of reading, you know, really just trying to absorb as much information as I can, and not being afraid to go to our CSO or anyone really on the scientific or development team to engage them on education, right? And really trying to answer, to learn more, to understand some of those questions. And I think especially now there's so many resources, everything from, as I said, PubMed and, you know, online courses, but even, you know, just being able to go to the websites of other companies and absorb information that way, whether it's from webcasts and things like that. But for me, that's really what I leverage is a lot of just you know, absorbing information online.
Anyone else? Pauline, Terry, Hunter?
I guess just on the pure like finance side, I think especially in Boston, there's a good network of finance executives. There's ABFO, there's some other groups, and people are very willing to share information. A lot of times you're like, you know, one of two people at a company, so people are always willing to help. So I definitely encourage you to, you know, tap into those networks, because people are it's very collaborative amongst companies.
Yeah, I'd echo that. And I'd just say, and this is true for everybody, doing a skills analysis, right? And understanding where your gaps are and not being afraid to talk about that and build to those gaps, whether it's, you know, making sure you've got the right team around you, or taking some online courses, or to Pauline's point, asking questions and reaching out to additional resources. I think that first step to really advancing is understanding okay, where am I really good and where do I have gaps and how can I build to those gaps?
Terrific. Thank you very much, Terry Ann and Pauline. And I guess this is somewhat of a question, but I see it more as a silver lining of the COVID-19 situation, and that is, does COVID and remote work create opportunities to be more geographically diverse and not just concentrated in Boston? And I think it certainly provides this sort of awakening in a virtual world, and the ability to use technology as a basis to stay connected certainly enhances some of that, but would enjoy to hear from any of you on any perspectives you might have on that.
I might offer, and we had a specific management team discussion about that within the last 2 weeks. And I would say we are a bit cautious on that thinking. I happen to live in the New York area and commute to Boston, but I am absolutely committed that I'm in the office Monday through Thursday every week. Yeah, that I'm not traveling in normal times. And I think there's just a general feeling that maybe not for the senior executives, but certainly for the broader rank and file of the company, the absence of an in-person presence can be really detrimental to their ability to understand the business and provide cross-functional value add. So I suspect that we will, always look carefully at certain cases where we have a truly exceptional individual who's a candidate who's not going to be able to be on site as frequently, but that will be exceptional.
Gotcha. Anyone else? Okay, great. Well, thank you all. I'm just going to hand it back to Kamal, but in addition to Kamal's remarks, wanted to thank all the panelists for their participation and the audience for their questions. Thank you.
All right, thanks, David. So, we covered a lot of ground this morning. I want to thank the audience, David, Pauline, Terry Ann, Senthil, and Hunter for your generous time and an engaging session on the art and expertise of today's successful cross-functional life science CFO and financial executive. I'm also grateful to Chris, fellow co-chairs, and MassBio for providing a platform to discuss the ever-evolving role of the financial executive. And just as a friendly reminder, the session has been recorded and a playback will be available 24 hours on the MassBio YouTube channel. So with that, please take care. I hope everyone has a good day, and thank you.
Thank you very much.
Thank you. Thank you, Chris.
Take care.
Bye-bye.
Bye.